Today I will be speaking about the impact of event scale, which is a screening tool for post-traumatic stress disorder. This is a standardized geriatric tool that is used to evaluate distress through trauma. This tool is reliable. It measures, monitors, and guides recovery. This tool is used for older adults. In this case, the older adult patient, she presented to her healthcare provider with stomach issues and sleep disturbances. Upon physical assessment, the doctor determined that there was no physical cause, but there was an underlying issue. The impact of event scale helps to piece together a puzzle which identifies the underlying cause. In my patient case, she lived through Hurricane Katrina. As a child, she was on a ferry with her family, and the car she was in hit the ferry's gate. So she remembered that as a child, and then Hurricane Katrina took her back to that place. There was a treatment plan developed for this patient, which includes psychoeducation, which helps to destigmatize the asking for help. The events that happen, for instance, the hurricane, the therapy will help to normalize this for the patient and bring back positive memories which are reinforced. The scales that are used are also talk therapy. You involve the family and educate them that their family member might need support. Also, there are other scales that are used in conjunction with this one. The geriatric scale for depression, it's used to kind of rule out depression. Medications are also reviewed, and the sleep quality index scale is also used to see if there's any improvement in her sleep. The risk factors for this patient, and the reason why you would use an impact of event scale, is a patient with a previous history of traumatic event, gender, a woman, and a comorbidity of substance abuse, psychiatric issues, and low coping mechanisms. This patient's safety is fostered using this tool because you find the underlying cause. Because the patient might start to show sign of avoidance, so she avoids people, she avoids going to pick up her medications. And if these underlying causes are found, she can be better able to take care of herself. And if I was doing an SBAR on this patient, in my SBAR I would say my patient is a 93-year-old female. She presented to her healthcare provider with stomach and sleeping disorder. Upon evaluation, the doctor determined that there was no physical issue, and the healthcare provider referred her to this facility. The patient has had a previous history of trauma as a child, and upon assessment with the impact of event scale, it was determined that a treatment plan would be put into place. And it was recommended that the patient follow up for another impact of event scale evaluation within the next 4 to 6 weeks. Thank you and have a good evening.